Hello, this is Aaron from the Pharmacist Network. This video is about Glucophage. Glucophage is an oral glucose lowering medication manufactured by Bristol Myers Squibb. The generic name is metformin hydrochloride. Glucophage is available in 500, 850, or 1,000 milligram doses, and in an extended release formulation of 500 or 750 milligram doses. When you pick up your prescription, always double check that you are receiving the correct dose and the regular release or the extended release product. Store your Glucophage at room temperature and in a light-resistant container. When you are starting Glucophage, be aware that you may have your dose adjusted a couple of times. Glucophage is indicated for the treatment of type 2 diabetes. It is also used in women with polycystic ovarian syndrome, or PCOS, to increase the chances of getting pregnant and to maintain a healthy pregnancy in women with PCOS. Glucophage lowers blood glucose levels in several ways. Glucophage lowers the production of glucose in your liver, it decreases the absorption of glucose in your digestive tract, and makes the cells in your body use glucose more efficiently. Glucophage does have several drug reactions. Be certain to tell your prescriber and pharmacist all medications and supplements you are currently taking. Most drug reactions can be managed with dose adjustments. Others require further evaluation. Glucophage is usually taken once or twice daily. Take it according to your prescriber's instructions. Take metformin with food right before eating or with a meal. Avoid alcoholic drinks while on metformin. Tell your prescriber if you are pregnant or planning on getting pregnant. Although metformin is used for patients with PCOS, it is important that your prescriber is aware of your pregnancy. Glucophage is excreted through breast milk, so if you are a breastfeeding mother, you may need to discontinue Glucophage or discontinue breastfeeding. Tell your prescriber if you regularly drink alcohol, if you have kidney dysfunction or disease, or if you have had diabetic ketoacidosis. If you're going to have surgery, let your surgeon know that you are taking metformin. You may need to temporarily discontinue metformin. The most common side effects of Glucophage are loose stools, nausea, vomiting, flatulence, indigestion, and headache. Talk to your prescriber about managing side effects. You may need a dose reduction and to taper up as your side effects allow. Lactic acidosis is a rare but serious potential side effect. Lactic acidosis can develop slowly or rapidly. Call your prescriber or go to the emergency room if you experience cold, clammy skin, profuse sweating, bluish coloration of lips and nails, chest pain, rapid breathing, rapid heart rate, weakness, decreased urine output, and unusual anxiety or confusion. You will know if Glucophage is working for you by checking your blood glucose levels with the glucometer and when you have your A1C levels checked by your prescriber. If you miss a dose of Glucophage, take it as soon as you remember. If it is time for your next dose, do not take extra medication or double doses to catch up on missed doses. If you or someone accidentally takes too much metformin, call Poison Control at 1-800-222-1222. If an overdose is suspected, go to the emergency room. An overdose of metformin can be fatal depending on the patient and the amount of medication taken. It is very possible that you will be on metformin or another oral diabetic medication for your lifetime. You may be able to decrease your dose or discontinue metformin with rate reduction, dietary changes, and increased exercise. Keep taking metformin unless your prescriber tells you to discontinue it. We hope this video helped you understand Glucophage and generic metformin. If you have any more questions, please talk to your pharmacist. Thanks for stopping by the Pharmacist Network.